Good morning, good afternoon, good evening from wherever you're watching this video from, and welcome to my channel. If you're new here, my name is Belinda Melvin. Well, October is Breast Cancer Awareness Month. We're coming to an end of October, and this month wouldn't be better without me letting you know what breast cancer is, the risk factors, the signs and symptoms, and above all, breast self-examination. So October, it's Pinktober. It is Pinktober. So October actually, it's the month dedicated to raise awareness, especially on the breast cancer awareness. It is the time that we get to acknowledge the strength and resilience of women battling with breast cancer. So today, there are things that I need you to understand, especially this month of October, where we get to celebrate our warriors, our women who are battling with breast cancer. So someone might ask, what is breast cancer? Well, breast cancer is a cancer that affects the breast, mostly women. So men also have some breast tissue in them, and they may develop also breast cancer, because I know when you talk about breast cancer, what clicks into our mind, that is a woman thing. But again, do you know that men also can be affected with the same? So with them, they have a breast tissue. Yes, they can develop breast cancer, though it is rare. And here in Kenya, breast cancer is most common cancer amongst women. And statistics show that 7 women die every day in Kenya due to breast cancer. And this brings me to letting you know what are the signs and the symptoms of breast cancer. So the signs and the symptoms of breast cancer, I've written them down and I'd like to share them with you. Symptom number 1, nipple retraction, or your nipple turning inward. When you notice that, you can look, a good example, it is an orange. You see that dot that is always on an orange when it turns inward. So when you talk about breast cancer, we do use the oranges to explain the signs and symptoms of breast cancer. So when your nipple retracts, that is turning from inward, it is something to be worried about. Another thing, swelling on all part of your breast. So when you see swelling on all part of your breast, it's also something for you to get worried, and it requires you to see the doctor ASAP. Another one, breast stroke, nipple pain. When you feel like you have a lot of pain, unbearable pain that you can't withstand, especially in your breast and also your nipples, please, it's something that you should get worried about. Skin irritation or dimpling, it's also another sign of breast cancer. A lump or a mass in your breast armpit. Remember, when doing the self-breast examination, we'll get to know how we should examine our breast. So in our armpits, when you realize that you have a lump it's basically a swelling on your skin. So when you realize you have it on your skin, please, it's wise, or rather advisable, that you seek medical attention. Another symptom is nipple discharge. So on your breast, you're having a shower, or rather you're doing a self-examination, and you realize that in your nipple there is discharge coming from it. So it's also advisable that you seek medical attention. Those are the signs and symptoms of breast cancer. And maybe someone might be asking herself or himself, who is at risk of getting this breast cancer? So all women, we are at risk of developing breast cancer. However, the risk is higher when it comes from, maybe, let's say, like cancer can also be inherited. So it will be riskier. The risk might be higher when maybe you had breast cancer in your family, that is maybe your mother, your sister, or it ran in the family, you might be having, when you have that history, in short, yeah, the history, that's the term. So when you have that history in the family, you are likely to develop cancer. And another thing is, if you have ever used radiation therapy, you're also at a risk of having cancer. So, who is at risk? All of us, especially the women, we are at the risk of detecting breast cancer. Someone might be asking herself, how do I do breast self examination? Well, worry no more, because you know what? I got you. So, how do we examine ourselves? Remember, self examination, especially for the breast cancer, should be done once in a month. 2 or 3 days after you've received your monthly salary, the menses, you know what I'm saying? Yes. So after you've received your menses, 2 to 3 days, please ensure that at least you do breast self-examination, and let's get into it. So when you're doing breast self-examination, this is what is expected of you. 1, stand in front of a mirror, then lift up your left hand up to your back, the back of your head, then use your right hand to massage your left breast. So this is my hand over here, and this is my breast over here, my left breast. So massage it slowly, massage your breast slowly, then you can move up over here, massage it slowly, 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 slowly. And then you can also do the same to your right breast. You lift your hand up and then use your left hand to massage your right breast. Slowly, slowly, the same way you have done with the left breast, you do it to your right. You come up here, you massage it slowly, and mind you, if you notice something in your breast, it might be a lump, that is just a swelling on your skin. If you notice a swelling, please, it's advisable that you do what? You go see the doctor ASAP. You're doing that, you notice something unusual, please ensure that you visit the nearest hospital, go see a doctor, and they can be able to detect what is happening to your body. Yeah. So breast self-examination, very vital. That is check. Ladies and gentlemen, as we wind up, under prevention, the best protection of breast cancer is early detection. And early detection is achieved through screening or early diagnosis. Screening involves testing of women to identify cancer before any symptoms do appear. So it's also advisable that we visit our nearest medical institutions to ensure that we get screened, we detect it earlier. The earlier, the better. And we normally say mapema ndio best. Mapema ndio best. So early detection actually helps us to prevent ourselves from developing cancer. So I don't know who is battling with cancer. I don't know who just found out about his medical status right now, but I just want to tell you that if you're battling with cancer or you just found out about your situation at the moment, you're not in this alone. Remember, finding cure starts with hope. And it's my prayer that you don't give up on yourself. It is my prayer that you keep hanging in, knowing that you can do all things through Christ who strengthens you. And above all, I want to tell you that you are beautiful, and do not give up on hope. So, ladies and gentlemen, thank you so much for watching till the end of this video, and I will see you in the next one. Bye bye. Spread love.